Live now. Morning, everybody, and welcome to another Talking Tuesday. Today, I'm here with Yuki Smith, who's a GP cancer lead and a Macmillan GP, and we're talking a little bit about cancer awareness today. Hi, Dr. Yuki.
Hi there. Hi, everyone.
Hi. So, would you like to tell us a little bit about your background, how long you've been sort of working around cancer and that sort of thing?
Yeah, so I'm a GP in Eaglescliffe in the Stockton area, and in 2014 I started working as a Macmillan GP, which meant that Macmillan funded me a job for 2 years to work on anything to do with helping improve cancer diagnosis or caring for people with cancer, and to raise awareness among other GPs on, how to identify cancer early. And then after the 2 years, the CCG, which is the commissioning group that sort of funds lots of different things in health, they carried on funding my job to do that. So I've got a part-time job doing that, and then the rest of the time I work as a GP. So now my job covers sort of Hartlepool, Stockton, Middlesbrough, Redcar, Cleveland, because we've all become one big group. So I have visited practices in Hartlepool in the past, talking to GPs in Hartlepool about sort of diagnosis of cancer and how to encourage people to go for their screening, which is quite important because screening for breast and cervical cancer and bowel cancer means that they can spot something really early before a patient's even got symptoms. So it's really good to go for screening.
And in terms of screening, is that all going ahead as normal at the moment, obviously with the pandemic?
Yeah, they're trying to play catch up, so they're pushing very much on cervical screening, because that is something that, well, GPs we have control over because it's done within the practice. So all practices have been encouraged to try and clear the ones who are due over pandemic and get those people in for their screening and try and get back to sort of like normal pickup rates of that. The bowel screening, I don't think they have started sending out the kits yet. That's still sort of a little bit on hold. The breast screening, they're sending out letters to women saying that, they are now due and to ask them to make an appointment to do that. So it's not quite up to what it was before pandemic in terms of everything back to normal, but they're trying to get people in as much as possible.
Oh, brilliant. And I know there's a lot of talk about whether or not you can get in to see your GP at the moment and things like that. People are concerned about whether or not they're going to be able to see the GP. Is that all okay now? Is it possible to get to see the GP if you need to see one?
Yeah, the GPs are still sort of having controlled access. So everything is done the telephone call with the GP initially, well, either a telephone call or a video call, because they want to sort of minimise the amount of footfall of patients coming out, particularly because sort of quite a lot of the patients are vulnerable already with other health conditions, so we don't want to drop out and have them sitting in a waiting room with lots of other people. So the initial conversation with the GP would always be either a telephone or a video call, and then depending on what the symptoms are, then the GP would arrange for them to come and have an appointment within the building where the GP can examine them. But yeah, I know there's this perception because a lot of practices are sort of having the doors are still closed and they can only sort of be buzzed in, as it were, which makes people think that we're closed, but we're not. It's just, a way to sort of control how many people are in the building at one time.
Yeah, of course. And I know obviously it's different for all the different cancers and it's different for every individual, but what sort of, obviously we were talking a little bit before we came live and we were talking about how obviously the symptoms of lung cancer can be quite similar to sort of COVID, obviously with the cough.
Yeah.
What other sort of things should people be looking out for? We said, obviously, you mentioned that the Northeast in particular has a very high rate of lung cancer compared to the rest of the country.
Yeah, yeah, that's right. I think it's partly to do with sort of historical sort of heavy industry has resulted in more people being exposed to things that are, can cause lung cancer, but also there's a higher rate of smoking, so that can lead to lung cancer as well. With the symptoms for lung cancer are a cough that doesn't clear up after about 3 weeks, or possibly getting chest infections repeatedly. So, you go to see a GP, they say you've got a chest infection, you get antibiotics, it clears up, but then soon after that, it comes back again. So if that sort of keeps happening, then that's something that needs to be looked at more. Or sometimes they're feeling breathless, sometimes they're feeling more tired. And with COVID, it is sort of, quite often having a cough, feeling tired and breathless, they're all part of COVID. So that unfortunately has meant that people who before COVID would have just said, oh, I'll go and see the doctor because I don't feel very well and I've got this cough. And they probably would have gone automatically into, let's make sure it's not lung cancer. Now they're waiting a while because they're thinking, oh, it's probably COVID.
Yeah.
Particularly, I think it's a bit easier now because they can get hold of COVID tests, but certainly back in the middle of lockdown, COVID tests weren't available, and so they kind of just waited. And there was also the fear that, well, actually, I'll just sit out and wait till everything settles down because, who knows how things are in the hospital.
Yeah, but these are things that you don't want to wait on, isn't it? If you've got any concerns at all, then do speak to your GP.
Yeah, if you're worried at all, then certainly, we are open. I know sometimes it's hard to get through even, on the phone because, the phones are really busy now. But we are open, and, just try and get in to have a telephone call with your GP so that you can talk over your symptoms. And then you can get a chest X-ray, and the getting a chest X-ray is done in a really safe way, so you don't need to worry about maybe catching something while you're in hospital getting the X-ray.
And this month's Stoptober, isn't it? So if you are sort of thinking about giving up smoking, and it's a great time to do it. Is there what sort of support is there out there for people if they're wanting to sort of give up smoking?
Certainly get in touch with your own practice to see what support there is. I know, unfortunately, the smoking cessation service isn't that there isn't much of one as there used to be. So there was a public health funded smoking cessation service, but there's still they still go to pharmacies and get support in getting the patches and different types of things to help you stop smoking. And there is the quit line that the NHS have as well.
Oh, brilliant! And I think if you search Stoptober as well, then that should bring up some different advice. And I think there's an app now as well, as so that there's plenty of different things out there if you're not wanting to go and see somebody, if you don't feel comfortable seeing somebody right now.
Yeah, that's right.
So could you tell us a little bit about sort of, again, I'm assuming it's going to be different for everybody and different depending on the sort of the cancer that we're dealing with. Could you tell us a little bit about sort of the procedure and what people will go through from that first GP's visit?
So yeah, let's say that let's say it's a lung cancer, for example, or possible lung cancer. So they phone up and they talk to the GP, go through what they've got, and the GP thinks that yes, this is something we need to look into further. So they would arrange for a combination of things. It might not always be in the same order, but there would be a chest X-ray that you would get at. So that's done as a walk-in service at North Tees Hospital in the lung unit. And then there would be some blood tests and a face-to-face examination to sort of examine the patient. So the three things sort of will happen in variable order depending on, you know, what's more available at that point. And then depending on the result of the chest x-ray or the blood results, then the GP would then do a referral to, if the chest x-ray showed that it might be lung cancer, the GP would do a referral to the lung specialists to look into it further. The hospital also have a sort of what they call a fast track. So if there is something on the chest x-ray that is highly likely to be a something like lung cancer, then they actually automatically arrange a scan, you know, before, you know, even getting in touch with the GP. But they would tell the patient there and then that that's what they're doing.
Right.
So there's quite a streamlined pathway of how it happens. And sometimes, because, you know, different cancers can all have sort of similar symptoms, so, you know, the chest x-ray might be okay, but something on the blood results sort of points to something else, so that's something else that might need to be looked into. Does that make sense?
Yeah, that completely makes sense.
Yeah.
And what support is there in terms of, obviously, if you do get that diagnosis? Obviously, Macmillan's a big name out there.
Yeah. So all the different units in the hospital, certainly the ones for major cancers, they have a specialist nurse, and quite often they call them Macmillan Badge, which means that although they're not employed by Macmillan, they'll be employed by the hospital, but Macmillan will offer them training and education, so they get that support on how to, and they also get all the literature that Macmillan produce. So anyone who does sort of like that, they go and speak to the consultant and get told the diagnosis, and there will be like a clinical nurse specialist so that they speak to at the same time. And they quite often come out with sort of, I've had patients saying, oh, I've got so much stuff to read now, you know, because it's like lots and lots of information. So they do try and provide as much support as possible. There is also the Cancer Information Centre. I'm not sure for certain. Before COVID, what would happen is that they had their main site in North Tees Hospital, but they also had they ran for 1 day a week on a Wednesday in Hartlepool, but they were also available on the phone if, you know, they couldn't get in. I'm not quite sure what they're doing now, particularly with COVID, but they do have a phone number. When I can actually send you that phone number if you want, so you can share that with everybody.
Fantastic. And you did mention just before we came online as well about some training that's available.
Yeah, so Judy Chatfield, who is her role is to promote awareness of cancer among the general public, because one of the problems we have as GPs is that we can only refer the people that we know about. So if people don't come and see us or phone us, then we don't know about their symptoms and we can't refer them. So her job is to raise awareness of signs and symptoms of cancer, and also sort of encourage people to go for the screening, because the screenings are not always pleasant. You know, I mean, you know, none of us like going for a smear, but it is important, and it's just trying to sort of encourage people and sort of like look at what people are worried about and trying to reassure them as much as possible that, you know, it's okay. So she does these Zoom online training sessions, which there's a variety of topics, the session can last from an hour to an hour and a half, depending on how much discussion there is. And it would be arranged by getting in touch with her. And again, I can share the details of that with you, so that people have access to that.
Oh, brilliant. And it's just really, really important for people to have these conversations. I know it's people say the C word, and it's a scary word, but I think at some point it's something that everybody is going to be affected by or know somebody who's affected by it. And
Yeah,
it's something we have to have these conversations about so that people know what to look out for and know to go and get help if they need that help, and don't just leave it. The doctors would rather you went and it was nothing than for you to not go and it turn out to be something that they could have dealt with at the time, and then obviously it's as it goes on it's much harder to treat.
yeah, exactly. People always feel, oh, I'm sorry, I wasted your time, but it's actually really nice to tell someone, no, you're fine. There's nothing wrong, because it's actually much nicer than having to say, oh, I'm sorry, there is there is cancer. And the other thing is, cancer's not the death sentence it used to be.
No.
So if we do get the diagnosis early before it's spread, then the outcomes are fantastic. The people survive a long time, 20, 30 years. If say there's someone who is 40 when they get say a bowel cancer diagnosed and it's early and they get the operation, then they just carry on living their normal life. So it's important that we get people at the beginning rather than when it is towards the end, and then there's not so much that can be done.
Yeah. If anyone does have any questions for Dr. Yuki, if you want to put them in your comments, and then we should be able to see them and hopefully we'll be able to answer them. But just saying about, obviously it's not the death sentence anymore, and the importance of screening. I know from personal experience, my mother was diagnosed with breast cancer last year, and we were
Oh,
extremely lucky. It was a mammogram that picked it
yeah,
up, and it was
yeah,
actually it was so tiny, and it was because of that mammogram that they were able to pick that up and treat it, and now she's fully clear. So it just goes to show that it's really, really important to go and get these checks and the screening done. And like you said, it's not pretty, it's not nice, but
mm,
it takes a couple of minutes and it's done, and the nurses have seen it all before, they're not bothered. And like you said, it must be a wonderful feeling to be able to tell somebody, no, it's not cancer, or the cancer's gone, or it must
yeah,
be a pretty special
yeah,
feeling.
yeah,
So what we want to reiterate from today is, if you're concerned about anything, speak to your GP. They are still open. If you can't get through, just keep trying. They would rather speak to you and be able to tell you it's not cancer than obviously don't worry about feeling like you're wasting people's time, because it's never a waste of time when it comes to health.
no, it's not.
Oh, I think I've got a comment here. Hang on.
All right.
Oh, Deborah says, I've just received my letter to arrange an appointment as I'm now 50. So there you go. So yeah, so for the breast screening, that starts at 50, is it?
That's right. Yes. Yeah. You
Yeah.
might not. It might not be on the dot of when you turn 50, because people do it in the breast screening do it in a cycle. So sometimes women are possibly even 52 before they get the first one, because it's every 3 years. But
Mhm.
yeah, it is from 50 that you get one.
And does that what age does that stop at? Or does
At
it
70.
carry? Yeah, so
It, it,
my mum, it was actually her last mammogram that picked it up. So if we hadn't
right.
have spotted on that one, we wouldn't have known
Yeah.
until possibly too late. And then I've
If
got sorry.
I was going to say, if women, if they've gone past the screening age, so if they're over 70, they can still phone up and ask for another mammogram if it's been more than 3 years since the last one. So they can still get one, but it's just they won't be called regularly anymore.
Okay. And I've got Rob, and Rob says, over the past 20 years, cancer treatment has massively evolved. My dad died from a brain tumour, but now you see technology freezing and stopping cancer in its tracks. And that's exactly right. I mean, we have come so far, and obviously they're still working all the time to try and improve things and in
Yeah,
technology, and it's it's incredible what they can do now.
Yeah, I mean, things like radiotherapy, it used to be there were so many side effects, and you know, people sort of say, oh, you know, the treatment's worse than the disease, that kind of thing. But now the technology's got so good that the radiotherapy is just sort of targeted at that one bit that needs the radiotherapy rather than half your body in it. You know, there's been big advances in that.
Oh, fantastic. Well, thank you so much, Yuki, for joining us. It's been really interesting. Is there anything else that you want to just get across as a final point before we end the conversation?
Yeah, just don't worry. If you have got any concerns, then I'd rather that you got in touch with us and talked about it. Even if you're feeling a bit embarrassed about it, or you're feeling, oh, the doctor's going to think I'm wasting the time, we'd rather know about it and reassure you than you sitting worrying at home and possibly having something that needs treating.
Fantastic. And if anyone's interested in any of the information that Yuki gave us with regards to the training or any sort of contact details for support for people and families who are going through the cancer diagnosis and the cancer treatment at the moment, if you just give me a shout at Hartlepool Carers and we'll get that information passed on to you. But thank you so much, Yuki. It's been really interesting and really helpful, and we appreciate you giving up your time.
Oh, you're very welcome.
Thank you. It's been a pleasure speaking to you. Take care.
Yeah, thanks. Thanks for having me.
Thank you.